For those of you that don't know me, I'm Julie Amies and I'm from Energise Me. And Energise Me is a charity that works across the whole of Hampshire and Isle of Wight. And it tackles the things that prevent people from having an active lifestyle so that they can improve their health and their happiness. A couple of years ago, we co-produced, and some of you may have even taken part, we co-produced the We Can Be Active strategy. And this is not a strategy for Energise Me, it's a strategy for all of Hampshire and Isle of Wight, for anyone and everyone who wants to get involved. And that strategy set out a joint mission to inspire and to support active lifestyles so that we can all be active in a way that suits us. So why do we want to encourage active lifestyles and to prevent inactivity? Well, regularly raising your heart rate can reduce depression by up to 30% and other major illnesses such as heart disease, stroke, etc. by up to 50%. So being active is really important for both our physical and our mental health. Crucially though, for those health colleagues that are in the room, if we can reduce the number of people who are inactive, we can reduce pressure on health and social care systems. So that's our why. What's our role at Energise Me? Well, we exist to connect and collaborate with individuals and organisations in order to be able to join up some of the dots. Because if we are going to help people to become more active, it relies on lots of different people, lots of different organisations playing the role. So we want to show how organisations working together can create positive change to make things happen together. We're taking inspiration from elsewhere as well as innovating ourselves and taking risks to connect with underserved communities. And just to give you a couple of examples of some of the work that we've been doing, a couple of years ago we set up the agency in Southampton, and we've learned through this project that you can create strong networks in a local community, some trusted relationships to connect with young people. If you provide the opportunity and support, you can see young people really thrive to build their knowledge, their skills, their confidence to make a difference in their community. And that's the whole point of the agency. It's the young people themselves using their own agency in their own communities to create change. Our second cohort are running their projects right now in Southampton, and they've been engaging other young people in their community in the activities that they've set up and that we've invested in. But physical activity doesn't have to be an end in itself. And I know some of the things that we have to get over sometimes is that we all imagine that we've got to put on our trainers and, you know, have some skills to go and play a game of badminton or whatever. Physical activity isn't about that. It can be, but it's not the only thing. So it can serve the community too. So we're working with a national charity called Good Gym to set up 2 new opportunities in 2 locations in Hampshire. Now, Good Gym is a community of people who get fit by doing good. And it's really that simple. They walk, they run, they cycle to help community organisations and isolated older people by doing practical tasks such as cleaning a community building, cutting the grass, helping with gardening, etc., house maintenance, or helping out at sorting food at food banks and so on. Basically, the things that the community needs help with. So you get the joint benefit of you've been active, but also you've been doing some good. And just taking a recent example from the voluntary sector itself, we organise events at Energise Me to bring people together to make those connections. And Southampton Voluntary Services attended one of our We Can Be Active events, and it prompted them to think differently about physical activity. They were able to get some investment from Southampton Public Health to employ a physical activity navigator, and that's based on other models around mental health and dementia, for example. That physical activity navigator is now encouraging healthcare professionals to think differently about how they can support patients and clients to become more active, to address the health issues that they have. So when I was looking over the delegate list, I could see that there are representatives from arts organisations, culture, voluntary organisations supporting older people, forestry and outdoor organisations, etc. And you might wonder if We Can Be Active is relevant to your work. Well, when we did that work to develop the We Can Be Active strategy, we held a big online conversation, because it was during COVID, with lots of people all over Hampshire and Isle of Wight. And they told us that they want to be active in a way that suits them. And that's why we have supported arts and cultural organisations and so on. So Move Momentum, I don't know whether they're here today, that they were definitely on the delegate list, but they did a brilliant job taking their activity online to help keep their people that, you know, attend their dance lessons, to help them stay active during the lockdown. And we've worked with Fluid Motion on the Creative People and Places project that we have down in the New Forest, because what we're trying to explore is whether you can help people to become more active using other things, for example, the arts through dance and, you know, getting out in nature to take photography and so on. And we've also worked with Abria Housing Association, that may be in the room today, on a community garden, because that community wanted to be active by doing some gardening, and they used an underutilised space that was just not doing very much, and they wanted to make it much better. And now we're also working with Adult Social Care on the Live Longer, Better campaign, which I'm sure that you'll hear about later. So today's theme was about social action and making life better for everyone, and it's a great fit for the We Can Be Active joint mission. So as an individual or as an organisation, we all have the capacity to be a bold leader. We can do something to help relieve pressure on the health and social care system and to make life better for everyone, just in the everyday things that we do. So I haven't got a stand or anything, but you know, please do come and talk to us if you want to make a pledge through our website. Go and have a look at our website if you want to find out more.